Hi everyone, I'm Rajat. I'm the Chief Evangelist of Nature and Thought. We are taking a deep rooted expertise in healthcare to develop clinically validated, safe, and natural supplements for your health. It brings me great pleasure to take this topic of talking about women in science and bring in a dear friend, Dr. Gareema Prasad. To tell you a little bit about Garima will be very difficult because there's a whole lot of things that she has done. She grew up in Darwin, Australia, graduated from Melbourne Dental School in 2006, then has done an honors and completed her FRAC DS, which I don't know even if I've said it right, followed by a PhD in the area of early oral cancer diagnosis. She's published multiple publications in international journals, presented them in over 5 countries. She's been a practicing dental clinician in 3 countries for the last 18 years and holds teaching positions with the Melbourne Dental School and the Academy of Dental Excellence UK. She also runs a practice in Juhu, Mumbai, which is called the Dental HQ, and she's started a teaching academy alongside. And she's also become a delegate for the Australian. I'm going to read this out, but the Australia India Youth Delegation, which is a body that brings leaders from both countries together to collaborate on initiatives that improve business and trade between the two nations. As a friend, I couldn't be too more proud, and I am so excited to have her here. I'm going to have her join the stream in just a second. Hey, hi, Garima.
Hi, Rajat. Good morning.
Good morning. I'm so glad you're here.
Likewise.
Yeah, so Garima, I'm going to get into the topic right away. So tell me a little bit about your practice. What's keeping you busy today?
So like you said, my dental practice is in Juhu. It's a multi-specialty practice. We do everything there from implants to kids dentistry to adult dentistry. So that's what keeps me busy every day. Um, we've got a great team and I love working with them. Many of them are foreign trained, so we have a very similar mindset. And, we focus on preventive dentistry with minimal intervention and trying to bring that to patients in India that it's dentistry is not just about pain management, but also prevention so that you don't end up in a position where you're in pain and it costs you so much because you know how people are. Dentistry means it's going to be expensive, and I want to change that view.
Yeah, and at the same time, I know having first experience at your clinic about how diligent you are about your infection control, which is what's always sold me. So you're doing some amazing stuff, and congratulations for all of your accomplishments so far that I read out earlier.
Thank you. It was
So,
very humbling to hear it all put together like that.
so what got you into science? How has your career evolved? Why dentistry? Tell us everything.
So like you said, I grew up in Darwin, Australia. I grew up with my maternal grandfather, who was a tropical medicine specialist in Darwin. And so I always knew growing up with him, I wanted to be in healthcare delivery. I wanted to see patients. What really attracted me was he'd always come home and have stories about how it's not just treating that particular disease, but it's treating the whole psyche of the patient. And you
Mm.
build a rapport with the patient, and you talk. I talk with my patients. The dentistry is a small part. You understand their psyche, you understand where they're coming from. So it's basically a people's profession. And I think that was meant for me. It's evolved in the sense, so I'm a dentist, I'm a healthcare deliverer, but I've always had a passion for research,
Mm.
cutting edge research. Fortunately, the University of Melbourne offered me a full time scholarship to do a PhD in one of the topics that was really close to my heart, oral cancer. So I got into cutting edge research at Melbourne University. So it's evolved from where I've been a dentist. I moved on to being a scientist and a researcher. And then when I moved to India, I actually became an entrepreneur and a business person because I run my own practice. So I think that's what got me into dentistry, at least, because it wasn't just a narrow field. It allowed me to be many things. and continue doing everything part time. So I love it. I love the vastness that this profession brings.
No, and it absolutely shows in your work. And I think what struck me about something you said was the fact that today, I think at the current time, everybody talks about holistic medicine, and you've been doing that from the beginning. Of course, taking a page from your grandfather, but that's amazing because I do agree there's always a lot more than treating the symptoms, and taking care of things like that. So that's fantastic. Now, you've already talked about your grandfather, but was there anybody besides him, or how do you think he also became a role model for you?
So with my grandfather, just quickly coming back to him, I'd meet his patients, I'd see how grateful they were. I saw he was making a change and an impact to society, little by little, but he had a career that was over 55, 60 years long. So you touch many lives that way. So yeah, I think he was the main person. He instigated it, but Rajat, I feel like I've been very fortunate. I've always had the best of mentors, whether it was my professor who guided me during my PhD, whether it was this doctor called Dr. Subir Banerjee, who runs the Academy of Dental Excellence in the UK. I've always met amazing people who've somehow, I guess, become mentors. We've
Hmm.
worked together, but they've been amazing people and we all have a similar mindset of making a change for the better.
Yeah.
So, yeah, it's a little hard to say, do I have one role model? I think I'm just blessed with the right people at the right time.
That's
Um,
amazing. That's amazing, Gareem. And it's always amazing to acknowledge all of your mentors and everybody that's had that impact on your life. Um, for you, how do you, I would say, take science and apply it to the world outside? Like just something beyond like how has your training, your experience prepared you for life?
I think my training, my experience has pretty much shaped how I am, especially with people. Um, Dentistry can be a really daunting profession, and also for the patient. I've learnt to be empathetic. I've learnt to listen to the people. So
Hmm.
even in my relationships, I like to listen to what people have to say before I speak. I think that has really shaped. I like to see things from people's point of view before I respond. And I wasn't always like this. It's been a long career. It's shaped how I work, how I think. Like I said, my relationships. My PhD made a lot of changes in the way I was. I learned how to look at a situation from many different angles because that's what
Hmm.
research teaches you. There's not only one answer, or there's not always a right answer. There's many possibilities, and you investigate all of it. And I know that's become it's become a default. It's how I approach relationships, how I approach problems in life. I don't jump to a conclusion. I don't look for a right answer. I know that there's many possibilities. So definitely 18 years of a career where you're constantly dealing with people has completely shaped how I am.
No, that's amazing. And I think, yeah, definitely. Like when you're experimenting, and you're thinking about, I think for everybody who has had that kind of a rigorous training, it definitely helps to have that kind of perspective in life also. And it's good to see how I love how you put it together. How has you worked in so many countries? You've lived in so many countries. How has being a woman in science different, or where do you see the change in perspective from one country to the other?
So it's definitely been an amazing experience working in three very different countries. I have to say, I think I might be one of the lucky ones. I've always had a great experience as a woman. I've always been presented with a lot of opportunities. I've never felt a disparity in my
Hmm.
profession between women and men, which I know is a blessing. It's been easy. India's been very good to me. As a businesswoman with no experience, I started, and patients have been good to me. It's been an easy journey. I have to, like, I do have to acknowledge that I've had luck on my side. Um, Three countries, very different experience. Working in a Western world like Australia, with your patients, even with your professors, you have more of a dialogue. Whereas in a country like India, where somebody with 18 years experience, somebody who's a senior lecturer, um, it's seen as a power of position. So
Mm,
often when I have a dialogue with my patients, I feel sometimes it's not appreciated. They sometimes start to think, why is she asking me? Does she not know what, you know, is needed? So it's been a learning experience. It's been a journey to gauge my patient. Things are changing in India. There's not that godlike perception that, oh, a doctor is God, So people do question.
mm,
People are becoming more informed,
mm.
but that is a sector of the kind of patients I see. The vast majority still come in and they want the doctor to tell them how it is.
Yeah.
And it's been a struggle because my training's not been like that. My training has been to discuss things, fully give informed consent. So it's definitely been an enriching experience. Singapore was amazing again. It's a very um, aesthetic centric community. Um, they look after themselves, they look good. So they have a very high expectation of work ethics and work
Mm.
delivery. So yeah, it's been all three countries have taught me very different things and helped me just to be a more well-rounded person.
It's amazing. We have so many conversations outside, but we never touch on these topics. So it's so good to kind of hear about these differences, this experience, and I think it's also so great. And I'm so happy for you that you've been, unlike a lot of women we know, and especially in science, that you've not had any hurdles. So that's fantastic, and I hope these experiences in India get better. And knowing you, I know that you, of course, your entire upbringing's been in Australia, but you're really an Indian at heart. You speak fluent
Yes.
Hindi. It's always amazing, right? We should have conducted the entire discussion in Hindi.
Oh, I don't think I would be so talkative then. I have worked on my Hindi, but no, like you said, like because this is about women, I'm well aware of the challenges women face in dentistry. I'm well aware that I've been lucky, and which is why I started the education part as well.
Mhm.
I want to give people that opportunity in India, both men and women. But of course, being a woman, you are, you do want to see women excel, especially having seen the past of how people have struggled. So bringing world class Western education and giving people in India access to it has been a big thing. Having said that, I do want to reiterate, I think Indian dentistry, Indian research is up there. It's not that Western is better. I just think it's different. It brings a different perspective. And I think as a clinician, as a researcher, or as anybody who wants to make an impact in the world, you can't have a vision from just one perspective. So being global is very important.
Yeah, no, fantastic, Garima. And Garima, I have one last fun question for you, which is tell us that you are a scientist or a woman in science without telling me that you are a woman in science.
I think my husband and my child would be the perfect one to answer that. Like I said, I think it's so deep seated, 18 years of being a scientist or researcher. I'm constantly conducting mini experiments on my family. I'm embarrassed to say it. My husband and my child will vouch for this. They're always like, stop doing this, stop testing me. And, like I'll come in as a counselor, I'll ask them, so what do you think? And they know that voice and they know that way of me. And they'll be like, stop it, just be normal. Don't treat me as a patient. Don't treat me as a study. So I think every day for me is showing that at heart I'm a true woman in science.
It is. It's really funny to hear that, and at the same time, I have an own personal story for this because every time I meet Garima or my son meets Garima, there's always a. Can you show me show me what you, and I'm like, okay, no, I haven't done the right things. I'm trying to hide my face, so it's very difficult to give your perfect smile when you have a guilty conscience where you cannot do that in front of Garima because she's, I feel, on the clock always, and it's amazing. So, thank you for being such an amazing dentist and such a good friend. And this has been really humbling to hear about so many different things that we don't get a chance to talk about otherwise. And I would leave you with, like, and this is, I know, kind of out of syllabus, but one thought about, do you have any last final words for wisdom, words of inspiration, motivation for other young girls in science that you'd like to leave us with?
Um, I just think science is amazing. It offers a lot of opportunities. You can be a doctor, you can be a healthcare deliverer, you can be a researcher, you can be an entrepreneur, you can get into business. It's a profession. Science is very vast. It doesn't allow you to get bored. It's a long life. It's a long journey. You're constantly learning new things. I think the one thing I would like to say is don't ever feel you know everything. Science is constantly evolving. Science has made me a very humble person, especially when I was doing my research, made me realize how much I don't know, the importance of constantly upgrading myself, studying. We live in a beautiful time, I think, right now. You know, technology is evolving. Just when I thought, oh, I know everything about dentistry, you know, there's AI, there's there's other applications. So all the girls out there, if you are even slightly inclined towards science, go for it. There's many scholarships available now. Try and find a mentor if you can. Makes the journey easier. Be kind to your mentor. One day you will get to be a mentor too. I love being a mentor now, and you learn a lot. It's a beautiful journey.
Awesome. Thank you so much, Garima. It's been lovely having you. And I do hope that we can get this message out to as many people as possible. And thank you for being part of our Women and Girls in Science.
Thank you so much for giving me this opportunity, Rajat. It's been great.
All right. Take care.